lip filler dissolved. God damn it! God damn it! This is another hour? But the next hour of my life?
Listen, so the internet is so funny. Pull up the other, pull up what the comment section on this video. Look at all the, so the funniest thing that TikTok has done is that they've allowed people to start putting pictures in the comments, and the pictures are hilarious. They are hilarious photos right now. I love the comment section. A lot of times, sometimes even more than the video. So, dissolving your lip filler. What is going on in this video? Why does she look so puffy right now? We're gonna talk about filler in general, how you even dissolve it, why some people wanna dissolve it. You've probably seen a lot of headlines from different celebrities who've decided to dissolve their fillers. So that's actually become something new that people are doing, and a lot of people are now starting to avoid filler because they're concerned about the way that it looks. So we're gonna be talking a little bit about filler, how to dissolve it, and what some of the side effects of dissolving it are.
All right, so all things dissolving lip filler, here we go.
Here we go. So what is filler exactly? Filler can actually be in many different forms, the most common being hyaluronic acid. For this video, we're gonna focus specifically on hyaluronic acid because it's pretty much the only thing that's injected in the lips anymore. They used to inject silicone in the lips back in the day, but it's pretty much never done anymore. And so we're really gonna focus here on hyaluronic acid fillers, how to dissolve them, why you might wanna dissolve them.
Whether you have reflected on your choice and decided, nope, this isn't for me, or whether you feel like there's something stuck or persistent there and you just want it gone, or if it's an emergency and you're having an adverse event from the filler and you want to treat it, these are the usual scenarios where you're going to see hyaluronidase used to dissolve your hyaluronic acid filler.
So one of the common things that I see is this concept of a filler migrating, and you'll see people say that filler doesn't migrate. I don't really know where this concept comes from, given that MRIs have shown that filler can migrate, and a lot of times areas that we inject filler, for example the lips, doesn't have a clear like planar border. Like there's nothing in the lips, infrastructure wise, that's gonna keep things in the lip compartment, which is why some people, when they get filler, a lot of it stays where it was intended to stay, but a lot of it will migrate slightly or push out slightly, or sometimes even just how it was injected initially, it ends up there. It will create sort of this border around the lips, this puffiness around the lips. And so that's become very unpopular. A lot of people also got overfilled in the lips because it was a trend for a long time, and they've decided, I don't want to look like this anymore, I'm going to dissolve my filler. Another reason you might want to dissolve your filler is if you got injected into a blood vessel and now you have necrosis, and so that can become an emergency reason why you might want to dissolve your filler. That's less common, and sometimes you can actually get a little nodule under the skin because it bunches up and it kind of walls off and it forms what we call a granuloma, and that ball is a lump basically that you'll feel in your lip, and we might have to dissolve that. But we're going to be talking about specifically dissolving it more for aesthetic choices.
Right, and so what happens is when you want it dissolved, you have the filler present, you go into the office, they have something called hyaluronidase, the ACE at the end, meaning that it's an enzyme. This breaks up some of the cross-linking within the hyaluronic acid to help it break apart so your body can absorb it more readily. Now, there are a couple of things to know about this, one of which is that what you see here is not an allergic reaction. This is actually the usual reaction. This is a bit extreme, but it's really representative of what most people look like when they get their lip filler dissolved.
Right. So we're injecting an enzyme that is naturally produced by your body called hyaluronidase. So hyaluronidase is an enzyme that's naturally produced by our body. It breaks down our own hyaluronic acid. It also breaks down filler hyaluronic acid. Now, if you're somebody who's decided, hey, I got filler, and I want to get it dissolved for any reason, here's what you need to consider. First, what type of filler did you have? Now, when we're talking about the lips specifically, we're mostly dealing with hyaluronic acid. And there's really two or several types of hyaluronic acid that you can get injected in the lips. The two most common being Juvederm and Restylane. And depending on how it's cross-linked and whether it's monophasic or biphasic makes it easier or harder to dissolve. So monophasic fillers like Juvederm are a little bit harder to dissolve, and Restylane, which is a biphasic filler, is a little bit easier to dissolve. That's a little bit of nuance, but it's important to tell your injector or someone who's dissolving your filler what type of filler did you get, because it will determine how much they need to inject in order to dissolve it. So that's step one. You've decided to dissolve it, you've gone to the injector, they're going to dissolve it. What can you expect? So like Dr. Maxfield said, this swelling is not an allergic reaction and it can be expected. And you can also get allergic reactions to hyaluronidase. And so those are more inflammatory, more swelling, sometimes itching. You can even get angioedema where your mouth actually swells up and your throat swells up. So if you have any reaction like that, that's where you want to go to the emergency department immediately. And finally, what are you going to do after you get those hyaluronidase injections? What are the next steps?
So to minimize these untoward effects, like the swelling of the lips and if any pain that you're experiencing, because it is a little bit painful to get this injection too, you will do a cold compress like she showed in the video, dabbing your lips with that. You'll do that for a little while afterwards. And some people will even give steroids just to help dampen that inflammatory response and that the vasodilation and swelling that people experience.
Right, so that's what you're going to do in the immediate term, and then afterwards, after all your filler is dissolved, is it really dissolved? I mean, that's another debate, that hyaluronidase doesn't fully dissolve all filler, especially if it's heavily cross-linked. Sometimes it doesn't fully dissolve, and so you may be still stuck with some residual filler. The other common thing that we have is that people don't necessarily like the way that they look after they get their filler dissolved, and part of the reason is because you're pretty used to the way that you look when you had filler, so even if your lips are more full than they were before, they're still gonna look deflated compared to before. The second reason is because let's say that you gain a bunch of weight and then you lose a bunch of weight. What happens? Your skin and your tissue is sort of stretched out in that process. So when you inject filler, you're basically stretching the tissue. And when you inject hyaluronidase and you dissolve that filler, you're basically shrinking that tissue back down. But the drapes, which is your skin, are still expanded, right? So you might get some more wrinkling around the lips, your skin might look a less taut, and so that can take a while for it to snap back into place. And so a lot of people don't necessarily like the way that they look immediately after filler. Now it will get better with time, but just keep that in mind.
Right, and so, you've committed to this, you're aware of what may or may not happen after you get injected. There's this also expectation thing to be aware of, that it often takes multiple treatments, multiple injections to get rid of the filler too, so it's not always one and done. You might get to go through this a second or maybe even a third time. And then long term, like Dr. Shah said, there is always the big question, is it actually gone? There have been multiple MRI studies now showing that it sticks around a lot longer than you think if your own body's trying to break it down. Even some question that after hyaluronidase injected into it, does that completely break it down? Who knows? But this is still the most effective way to get rid of a hyaluronic acid filler, if not the only way other than surgical removal for you if you want it gone.
So that pretty much wraps it up. What you see in this video is a pretty expected result from hyaluronidase. Now, if you want to dissolve your filler for various reasons, whether it's a nodule, whether it's an occlusion of a blood vessel, or whether you just don't like the way that it looks aesthetically, now you can know what to expect over time. I'm seeing a lot less people interested in filler in the office because of all these celebrities that are dissolving their fillers. There are multiple ways to achieve volume and to achieve the aesthetic result that you want without filler, but filler is still used for the right reasons. You can use it to augment some of the losses that you have with time, whether it's fat pad migration or whether it's loss of bone density within the zygoma. So there's many reasons why you may want to continue using lip filler. It's not something to be scared about. We're just learning more and more about it as we have more experience with these injectables over the last 20 years. And so as we learn more, we teach you more. And so thank you all so much for tuning in. Please like, comment, and subscribe, and we'll see you in the next video.
We'll see you next time.